Welcome back, guys. If you are just joining us, this is INX Prime Live. Remember, we are on your screens every single Monday to Friday between the hours of 6 p.m. and 8 p.m. Now, it's important for us to chat to some of the most influential people out there. And tonight we are definitely chatting to Mohamed Hoosen Suleman. Now, he is an award-winning medical student, a community servant, as well as an advocate for change. Suleman has actually proven himself to be a leader in South Africa's healthcare sector, with his work earning him a lot of international recognition. Now, his commitment to excellence as well as to community service is an inspiration, and we look forward to diving into the impressive journey in the healthcare field. Now, we are actually joined with him right now on Zoom. Assalamu alaikum. Thank you so much for joining us, Mohammed.
Walaikum salam wa rahmatullahi wa barakatuh.
Walaikum salam.
For the
Can you share with us your story? I mean, I just want to understand. I know you've won a lot of international awards and accolades, and you have a lot of recognition. But what sparked your passion for healthcare and community service, and how did you get to where you are today?
all right. Please forgive me for the poor connection. I'm currently doing my rural rotation in the province of KwaZulu-Natal. I hope I am coming across clearly. I hope I am audible. So please bear with me. It's a rural township, and there's not much of civilization here. It's our final rotation of the block, and I hope really you can hear me.
No, we
So in
definitely can.
essence, my journey, yeah. So my journey, in essence, I think has been quite intriguing for me personally and also professionally. It's been a long 6 years that has now come to the final 6 weeks. And just last week, the class of 2024 of the UKZN and the medical school, we were doing our class photo, the official class photo of the class of 2024. And, for some of the students, we were just reflecting on the last 6 years and our journey. For me personally, the opportunities that had availed itself, the opportunities that my mentors like Professor Abdul Karim and Professor Glover, the former dean of the medical school, had, they had opened up to me. And it was eye-opening to see that the world is so big and with so much of opportunities, and it then becomes you know um, these opportunities that we ought to make the most of. So in essence, it was quite exciting for me. And in the last 6 years, or I mean in the last 6 weeks now of being a student, I hope to be learning a lot insofar as the rural healthcare and how the delivery of healthcare services to the most vulnerable, how we can improve, and to look at things that are in the system, in the Department of Health, that we can inform and influence to improve healthcare delivery.
Yeah, I think you play such an important role in that sense. It's good to be able to share input in the things that really, really matter. But I mean, I'm looking at you, right, Mohammed, and I know that you are a mover and shaker, you are a game changer, you are a leader. What has been your biggest motivation in pursuing this type of excellence and leadership in the healthcare field?
Yes, absolutely. That's an interesting with the inspiration. I draw a lot of inspiration and motivation from my elders. And to start off, my parents, my siblings, my mentors, they influence me and they motivate me. Uh, and I suppose that when you hold true onto those principles, those fundamental principles, those ideals in your life, you tend to, see some sort of progress. And you ought to ask yourself, um, is that what change can I bring about in the setting that I come from? And so what contribution that I can make? Um, and I just hope that the connection is still stable. And of course, I mean, I do apologize once again for the poor connection. But yes, I hold on to those principles of my parents, my mentors, um, like Professor Abdul Karim, who's been truly remarkable, who's been, you know, a person who that when he opens his mouth to speak, you're already inspired, you're already motivated to go into a field of research, to be asking the necessary critical questions. You know, in this coming weekend, I'll be speaking in Durban at the ICC about breast cancer, because in October, it is dubbed the Breast Cancer Awareness Month.
Yeah.
And, to be educating the population, the audience that will be in attendance, I think is truly remarkable.
Yeah.
So I see
We're
all
going to
of this
ask you a lot
as,
more about that, Mohammed.
instruments of inspiration.
Yeah, we're definitely
Yeah.
going to ask you more about that a little bit later in
So,
the interview. I just wanted to also get on to some other elements before we actually speak about that event happening this weekend. And I know it's a very exciting event. I mean, the ICC is a beautiful venue as well. I just want to touch on exactly what you mentioned now. You spoke about the fact that, it is the month for breast cancer awareness in particular. I wanted to know, in your opinion, what role does wellness play? Wellness in particular, what role does wellness play in preventing and treating diseases exactly like breast cancer?
yeah, yes, absolutely. When we talk about wellness, we talk about disease prevention and health promotion. You'd know that, in the adoption of the NHI, of the National Health Insurance, and the various other initiatives of the Department of Health, is that we're now moving from a purely curative approach to a preventative approach. The idea is to take healthcare services to the population as opposed to waiting for the disease to manifest and the patient then presents themselves to the clinic. The idea is now to get, it's to conscientize people to be aware of your health and well-being. Now, we can expound on this topic, but I guess for the purposes of the theme and the question you're asking, is that every disease process has risk factors, has causes. It then becomes important when we avoid those risk factors, we are cognizant of those risk factors and causes, that as soon as they develop, as soon as we see them, we present ourselves to the clinic, to our local doctor for the checkups and for the necessary screening. To answer your question, when you talk about wellness, there's two themes here. One is the disease prevention. Two is health promotion. Those two are fundamental themes that the Department of Health, is on this great initiative and this big project to be conscientizing our people and to take healthcare services to them with the ultimate aim to improve the health and well-being of the population.
Yeah, I definitely think that the government is heading in the right direction if they have that mindset, and it's very exciting to see that happening. Let's go back to what we were speaking about earlier, and you did mention that over the weekend you are going to be speaking at that very important event at the ICC in Durban as well. Tell us more about the actual event. What's it all about?
The event is being hosted by the KZN Wellness and Women Empowerment. So it's a foundation that was created, I believe, 4 years ago. And it's a foundation that undertakes projects and initiatives that seeks to improve not only the health and well-being of the people, but to undertake, it's like a non-governmental um, project or an organization that seeks to implement initiatives to improve the lives of the people. So I believe this is the fourth year that they are running with this event. And it starts at around 10 a.m. and ends around 4 p.m. on Saturday at the Durban ICC. That will be attended by a whole host of important people, I'm told. There will be business people. There are a few representatives from the national government, and there are some high-level speakers. I was fortunate to receive an invitation from the founder of this organization to be speaking on breast cancer, with a particular focus on the medical aspects as to what exactly is breast cancer, how does the disease manifest. So essentially, this event will take place on Saturday. I'm certainly looking forward to it. It's been a while now since they have extended this invitation to me, and I will be in Durban in the weekend for this event, and to be networking, to be also learning from others who will be attending. It's an event that I believe is strictly by invitation. However, those who are interested can reach out to the sponsors, and I think there's a ticket that they pay for a seat, and they can come through.
That's very, very exciting as well. And I know that we are getting comments and questions coming in from social media. There is questions from Naeem in particular. And he was actually asking about the ticket. So I'm glad that you mentioned that. But away from that, I mean, you're going to be speaking at this event. And, obviously you're very well exposed to a lot of the aspects in terms of the medical space in that sense and the healthcare space. I just wanted to know, what would you like people to take from your talk, let's say post your talk in that sense, 5 or 10 minutes after your talk?
Absolutely. And again, I think I must apologize, for the poor connection from my side. I would have really loved to be in studio with you. And please forgive me once again to you, the team, and the viewers for the poor connection that's on my side. Essentially, I think the key takeaways from the message, from the talk that I intend to do, is to educate the people about what is breast cancer. When we talk about breast cancer, about breast malignancy, so it's such a big topic that we can sit for at least 2 hours to speak about it. But in a nutshell, when we look at the grading, the classification of breast cancer from early to locally advanced and to metastases, where the actual breast cancer, the disease, has now spread to the other organs. I'll be touching on that. I'll be speaking about the risk factors, which are so important. When we speak about risk factors, we look at the women who have had prolonged periods of estrogen exposure. It's where they've had what we call the menarche, was early in life. For example, before the age of 12, when they reach menopause, which is far later in life, for example, over the amount of pregnancies, they've been, for example, if they were on this hormonal replacement therapy, these the obese patients, they smoke, they have a family history of breast cancer, they have mutations in the gene. We talk about the BRCA1 and BRCA2 gene. These are the risk factors that I'll be touching on, that if indeed you have any of these, you present yourself to the clinic. And of course, the talk will focus on from the risk factors to the disease manifestation, to the pathophysiology, how do we investigate for it, and also to speak on the management. In the interest of time, I'll just speak about what we call the triple assessment. It's so important. You present yourself to the healthcare professional. He will undertake a history taking. He'll do the clinical exam and do an investigation, which is 2 parts. One is the imaging, and the other is it's a biopsy that is done to actually confirm the disease. So I think that I will be focusing largely on the medical aspects of this very important disease that we need to be on the lookout. So in essence, that's what's, the key takeaway that I hope that the listeners, the audience, will find some value in the little that I will be speaking, and to heed some of that advice. If I've advised one person, I would have met that objective.
No, I mean, it sounds very, very exciting, Mohamed. But, we're definitely all looking forward to it. And I'm sure, tickets will be sold out and a lot of people will be looking forward to your talk. But again, thank you so much for the insightful comments and information as well that you shared with us tonight. Thank you again for coming on to INX Prime Live.
I do appreciate the invitation, and so thank you very much. And I must apologize once again, if any of the connection was poor, and please forgive me.
No,
thank you very
fine.
much.
Thank you so much, guys. That is Mohamed Hoosen Suleman, who is actually a healthcare activist as well as a leader. He's also an award-winning medical student that's going out of his way this month to be able to promote, create awareness, and also create the necessary exposure that needs to go out there when it comes to breast cancer awareness. Now, on that note, we are going to take a quick ad break. We'll come right back.